there's only two slides to really know, the kidney and the ureter slide, but I drew up a couple pictures here just to kind of show you as much as possible, mostly because I wasn't super happy with any of them. So here's the kidney. I don't know what animal this is from. Obviously, it's a pretty small animal if it can fit all of the kidney on a microscope slide. But anyway, what's this slide good for? What do you think one is supposed to represent? Cortex, and then two down here really would be the medulla. In 4, what you're seeing here are some of the collecting ducts going down. 3 would represent like a minor calyx. Okay. Actually, you know what? This is probably, this is probably a dissection of one pyramid from a larger animal. I'm not really sure how they got this slide. It's either that or it's some freakishly small animal. I'm not really sure. I think it's a larger animal, and they're trying to show you the thing here. But anyway, the rules still apply there. So this is, what's this? Well, the whole thing would be a corpuscle, but if I just circled the thing on the inside, what would you call that? Glomerulus, yeah. Make sure you pay, that's a good point. Make sure you pay attention to like what I'm trying to show you. If I were to circle the whole thing, call it a renal corpuscle. If I was just going to circle the inside part, make sure you say glomerulus or glomerular capillaries. What's this area in white here? Bowman space, okay? What other stuff can you see up here? Well, one of the things you're going to have to differentiate between is proximal and distal convoluted tubules. Okay, so the proximal convoluted tubules have little microvilli on them that help with reabsorption. And because remember, a lot of reabsorption is taking place in the proximal convoluted tubule. What does that mean? Why should you care? Well, what it means is when you make the microscope slides, the inside of proximal convoluted tubules tends to be sort of cloudy as all of those microvilli dissolve or disintegrate. They kind of fill up the lumen. So if the inside lumen part is not clear, like if it's got a bunch of crap in it, it's going to be proximal convoluted tubule. Okay? Whereas things like this or like that guy, right? Those are going to be distal convoluted tubule. They have a more well-defined, clear lumen to them, or like this guy over here, looks like it's probably DCT, or this guy up here are distal convoluted tubule. All right. Let me show you some more examples of those guys. By the way, they call all those little microvilli, they refer to that as the brush border. So that's a tip off that if it looks hazy on the inside, you're looking at the PCT. Okay? Most of what you're seeing up here in kind of this pinkish, where you can barely even see like a lumen, that's going to be proximal convoluted tubule. These other guys that are maybe a little bit lighter purple that you can actually see a better defined lumen on, that's going to be distal convoluted tubule. All right? So that's what's going on here. Again, there's the glomerulus, Bowman's space, and all that stuff. You know, so something like that's probably distal convoluted tubule. I don't know. Most of the other stuff's looking fairly. This might be a distal convoluted tubule over here. Most of the stuff though is looking kind of hazy, and it probably would fit into the proximal convoluted tubule. I mean, I'll try to give you a good example. I'm not going to pick something that's ambiguous. One more always helps when they're labeled. But anyway, notice the proximal convoluted tubules. They look hazy on the inside. They got some stuff there, whereas it's a little bit more clear, I guess, if you will, when you're looking at a distal tubule. Okay. And I also think, I don't know, maybe it's just me, but I also feel like I see more defined purple, like nuclei, when I look at a distal tubule. And it's kind of got a purplish tint to it. Whereas you look at, I don't know, the proximal tubules, it almost looks like there's a pinkish tint to it. Just another difference you can pick up on. This is just to show you the collecting ducts. So these are a bunch of collecting ducts that are basically kind of converging on where the renal papilla would be. What's this? That's the ureter. All right. The ureter, the inner layer here is the epithelial layer, and that's a transitional epithelium. Does anyone remember what happens to a transitional epithelium from A and P1?
It changes.
It changes its appearance. Like when the ureter is full of urine, it sort of stretches the wall, and when it's stretched like that, it'll look like a stratified squamous. But then when it's empty, like it is now, it looks more like a stratified cuboidal epithelium. So transitional depends. And you also have transitional epithelium on the inside of the bladder too. So pretty much, they actually sometimes call transitional epithelium urothelium. Okay, uro being like URO, like urinary system, not like EURO, like this is in England or someplace. Anyway, okay, so that's what's going on there. Right below it, this area in here would be the lamina propria. These layers going around the outside, a little bit subtle. Those would be the smooth muscle layers. There's an inner longitudinal layer that goes, so in a cut like this, you would expect to see the muscle fibers coming out towards you, and then there's an outer circular layer. Can I really tell the difference between the two on this slide? Not so well. I mean, I know relatively where the position should be, like around in here should be the ones coming out towards you, and then on the outside, it should be circular. That's just the opposite of what you saw with the GI tract, right? Remember with the GI tract, you have an inner circular layer and an outer longitudinal layer. With this, you've got an inner longitudinal layer and an outer circular layer, so it's just the opposite. All of this tissue that's on the outside that's helping sort of tether it or hold it to other tissues, that would be classified as adventitia. Okay. Go to another picture. Okay. Again, this would be the transitional epithelium. This area in here would be connective tissue, which you refer to as lamina propria. Some of these layers of muscle here would represent longitudinal muscle coming out towards you, whereas the ones going around the outskirts would be circular muscle. And then this lighter tissue that you see on the outside would be the adventitia. Oh, this is just a super duper close-up of one part of the wall. Here's the transitional epithelium. All of this stuff in here would be lamina propria. Some of these pockets of muscle, those would be longitudinal muscle fibers coming out towards you. That's why I did this slide, because you can kind of at least envision it a little bit better. Whereas if you get over here, then you're in the circular layer, and they're going to be going around like that. Okay. All right, that's pretty much it for this. Any questions about any of these microscope slides or anything? All right, so that's your last